Hey guys.
Hello. Hi.
Hey, Brian.
Hey. See, I finally got the dumb thing to work.
Good job, Brian. Good job.
Hey, that dumb thing is your lifeline to the outside world. Treat it well.
It sure took me a long time and a lot of helpers. I have no idea.
Good job.
So how are we doing? Are we about ready to hit it, or are there 5 of us?
Chelsea, you have the list. You know who all is on the line that said that they were going to be there?
Yes, we have, it looks like 24 attendees, and I can go through the list to see who all is here through for attendance. Okay, so I'm just going to start at the top. It looks like we have Becky Holmes.
Is that better?
Hello, everyone. Yes, I'm here.
We have myself, Chelsea. Hello, everybody. We have Diane.
Yes, I'm here.
Hi, Diane. It looks like we have Ruben.
Yes. Yes.
Hi, Ruben. Sam.
Yes, I'm here. Hello.
Hi, Sam. We have Amelia Davis with us.
Apologies for being late.
Hello, Commissioner Anderson. No problem. We're just going through roll call right now. All right. So we have Commissioner Anderson with us. We have Brian Gibbons.
Good afternoon.
We have Brittany Fox dating.
Good afternoon.
We have a couple. It looks like we have a caller who is unidentified. We have Carol Moser.
Good afternoon, everybody.
Dan Ferguson.
Hello, good afternoon.
Eric Nelson.
Greetings.
New Grendel with Hope Stores. Hi. We have Jorge Rivera.
Hello, can you hear me?
Yes, we can. Hello.
Hi.
We have Kendra.
Hello.
Can you guys hear
Hi.
me? I, for some reason, can't hear you guys.
We can hear you, Ron.
Oh,
We can hear, yeah, we can hear Ron.
Well, I'll work on it.
Okay.
I see Julie Peterson.
Hello.
Hello. Warren Noble.
Hello, I'm here.
Les Stolniker.
Hello, and I'm here, and I'll put my camera on for at least for a minute or two.
Well,
Thanks, Les. We have Loanne with us.
Hello.
Hi, Loanne. We have Madeline Carlson.
Good
I'm
afternoon.
gonna go back out and come back in.
okay.
We have Mariana Marquez Seidel with us.
Walla Walla water.
Walla Walla, thank you.
Water.
Marissa Ingalls.
Hello.
Hi. We have Martine Sanchez.
I'm here. Hi, everyone.
Rachel Guest.
Yes, I'm here.
Rhonda Huff.
Hi, Rhonda's here.
Ronnie Batchelor.
Ronnie's here.
Ruben Peralta.
Present.
I already called your name. Sorry. Now we really know you're here. Sandra Flores.
Good afternoon, everyone.
And then Victoria Bryan.
Yes, I'm here.
And then if I didn't call you, feel free to announce yourself now.
This is Wes. Can you hear me?
Hi, Wes.
Hi.
And then I'm wondering if Ron Anderson was able to make it. I don't see him. Or yes, he's right there. Ron, are you able to hear us?
Yeah, I think
Okay, well,
Leslie can try to
hopefully
call back.
he'll, okay, well, that's all we have. I'll turn it over to you, Brian.
Okay, thank you very much. Okay, so we can go ahead and open the meeting. Thank you all for being here. Thank you also for running that roll call. I'm going to go ahead and count that as introductions. I hope you don't mind. We always try to, as we start these meetings, recognize our obligations to pay attention to our conflict of interest in any of our dealings today and in our self-dealing transactions. Please be aware of that as we move forward. So thank you very much. Also, the first item always on the agenda is that we talk about the May 21st board meeting minutes. Assuming that we have had an opportunity to review them, certainly I'll give a moment to take a peek, and then please feel free to make a motion to approve or to modify as appropriate.
I make a motion to approve the minutes.
Very good. Thank you, Eric.
This is Sandra.
And
I'll
this is-
second.
Sandra? So a motion by Eric and a second by Sandra to approve the board meeting minutes from last month. All those in favor?
Hi.
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 Okay, is there anybody opposed? Thank you very much. All right, so let's jump into the GCACH reports. I think the first thing I saw in here, how do you want to do that, Carol? You kind of want to run that run that show on the?
Absolutely. We're just going to go through the report as written, and actually our first article is written by Rhonda. So if you want to give us a highlights, Rhonda, of your report and then a newsletter.
Thank you.
No, well, just briefly, actually, I think I gave the report at last month's board meeting or leadership council. I don't remember. But you had asked the community health centers participate in the Sentinel event or Sentinel workforce, Sentinel events. My joint commission is coming out of me. So on the Sentinel workforce, and so this was really a summary, I think, of the report that I gave at last month, talking about our workforce challenges related to COVID. And I think this is just a summary of the report that I gave last month. So I don't think I need to go into a lot of detail about it.
That's good. I reread this morning, and I like kind of it sort of speaks very clearly to what's the word I'm looking for? The innovation of moving people around where you need them, because everything's changed.
That's right.
And I think it encapsulates it really well. We're finding the same thing.
Yeah, thank you, Brian.
You know what? I look at what you're doing here as some of the things that, you know, that we've been trying to, it actually helps putting our head around how do we create nurse extenders in the inpatient side. You know, so that's an important aspect for us, because again, in Yakima County, things aren't getting a heck of a lot better. And you know, we worry about the surges that hit on the weekends when it's hard to find the staff. And you know, we've been able to, you know, it's one thing to spend money and get the facility right. It's another thing to find the staff to make the facility work the way you had intended it to work. If you can't staff 14 extra beds, it doesn't matter that you got 14 extra beds.
That's right. That's right. And I don't know about you guys, but we're sending a lot of staff people home right now. And so trying to be creative on how we use those folks that we have left has been quite a challenge.
Yeah, no, I thought your report encapsulated that very, very well. It really does speak to the challenges we're all having. So thank you very, very much.
You're welcome.
I'm going to share that with some of my folks, if you don't mind. All right, so on the next one, next item on here is from Lauren, correct?
Yes, and you all are very familiar with this project as you approved a budget for us last month. So I think the only thing really to share in this article is the testimonial that we received from Garden Village. And it's actually from a beach vacation themed care package that they received. And Rachel actually came up with this idea, so I will hand it over to her to share the testimonial.
Thanks, Lauren. Yeah, we contract with the Garden Village, as all of you know, and we really wanted to come up with fun ways to just bring some joy to these residents' life, you know, because they're all having really hard times right now with isolation and all of that. So we came up with these fun packages, and Garden Village had responded to us with some pictures on how they use their package that we sent them, which was the beach vacation package. And as you can see on the screen, you know, they said that not only did the residents enjoy it, but the staff really got involved and all of their spirits were lifted. They turned their cart into like a tiki booth, and then they took pictures and made drinks and went around to all the residents' rooms, and they said that they really enjoyed that and really had a great time. So I know that touched all of our staff's hearts, being able to see that and see how much it meant to them during these times. So, and we're having more and more testimonials like that as we purchase more packages for the other communities.
That's excellent. Okay, so who's next on your list on your vacation package? It's not us, huh?
So we have 23 other ones that we're working on. Right now, I just ordered 4 of the Roaring 20s package that we did for 4 different facilities.
Washington State Walla Walla Veterans Home, Emerald Care, Crescent Healthcare, and Garfield County Swing Bed. So I'm kind of doing it. The Roaring Twenties was the most requested so far that we've had. So that has been working on. So there's still quite a few we're still waiting for a response from, but we've gotten about half of those 23 back. So we're just kind of ordering as they come in now.
Okay. Yeah, that's really good too. Okay, thank you very much. Next item on here is the Washington Financial Executive Portal updates with Becky, correct?
Yes, thank you, Brian. So this report talks about to date, this as of January 1st, 2022 to June. Oh, there's a typo on there I just saw. It shows that we've paid out to our providers $19 million out of the district. But the second paragraph talks about what you all approved last month at the board meeting was that we could accelerate some of our provider payments, and so we did that. We had two big waves of payments that went out that totaled about $3.2 million. So that made a lot of our providers very happy. So thank you for that.
Okay. Okay. Any questions on this one? That looks good. Thank you, Becky. Next one is the practice transformation to cohort 3. That's Martine, right?
Yep, that is me. So this is just, kind of a small overview of how the cohort 3 sites are doing. They're currently almost at the end of their second quarter, so they almost have a half year of practice transformation. And we have, the sites vary. Like you guys know, we have skilled nursing facilities, we have, more hospitals, we have more primary care, behavioral health. So it's a mixture of, different providers. For some of those providers, I use an example here. I use Chaplain C Behavioral Health. That they just implemented, their 3 weeks into their new EHR that they were able to purchase with the money that they received from Greater Columbia. So I had a meeting with them this morning, and they're going through their risk stratification. So we went over the document that they created on how they're going to be risk stratifying their patients, their empanelment, the decision aids that they're going to be using, and all of that. I asked them, so how are you guys liking your new EHR? They're like, oh, it's great, great for the notes, for the medication management piece. It's easy for them to look up their past medications on this electronic health record instead of going through, different charts and trying to see, are you still taking this? So it's just, a lot easier for them. So, and just overall, the cohort 3 sites, they're doing fairly well. Given that we are in the midst of COVID-19, and they are seeing struggles with staff, just like other sites are experiencing. But they're pushing forward, and they're doing a great job with practice transformation, and I'm sure that we're gonna see great results coming out of them at the end of this year.
Okay. Y'all aren't able to travel. Are you doing meetings like this one where you're over the phone or you're over the computer?
Yep, all our meetings are virtual.
Okay. Okay, excellent. Thank you for that. I know those guys. I know it's a different game. Next item on here in your report is the Empowered by Data by Carol. What do you got there? With me, Carol? Did I do it?
There we go. All right. Sorry about that. No, this was just an article. I think it might have been in the community newsletter that we talk about the goals of Greater Columbia ACH and what drives us. And community empowerment is certainly one of those areas that, it's hard to wrap your arms around. And so what we have tried to show the community is that by delivering data, by showing them the data that is available in their communities, by showing them the COVID rates or the social determinants of health where we're better or worse than the state. It has been the foundation for all of Greater Columbia's decision-making processes. So this is just an article that really what we were trying to do with the presentations in April, May, and even today, well, maybe not so much today, was to show people how the data can help drive decision making. So at the end of the article, if you wouldn't mind scrolling down, Chelsea, the point about the COVID rates was really a call to action by our community members to empower them to understand the importance of wearing a mask or a face covering when they were in public or around other people, to wash their hands frequently, cover their mouth, keep 6 feet away from others to minimize risk of transmission, and stay home as much as possible. So it's really the piece of community engagement and empowering our individuals to understand why this is important. And that's why we use data in so many of these cases, is to make the case. That's all.
Okay. Well, okay. It's obviously the healthcare districts are struggling with this. We've had a couple of conversations. Rhonda, I know you and I were on a call last week where we were talking about how frustrating folks are finding it up here in Yakima County. And I saw your thing today also about monitoring, trying to go monitor mask usage and whatnot over the weekend. I think that'll be very valuable information as well.
Yep.
It's hard. It's hard. All right. Any questions there? Any comments to that report? Because that's pretty good stuff there. All right. Next report you've got is from Diane Halo, success shares from implementing telehealth.
Well, I think this was also shared, but hold on, let me pull up the report real quick again. Let me just see what I'm supposed to say. Basically, we have I asked the providers if they could share some ideas on how they're using the telehealth and maybe some good things, because I know sometimes we're hearing a lot of bad things about COVID. But so Tri-City Community Health said that they are using the telehealth mostly 95%. They've had big success using it. They've had 1,468 sessions with the clients.
Wow.
And delivered by telehealth, and they are using the grants from other sources to build out the whole telemedicine behavioral health capacity for all the Tri-City Community Health, and they're doing it out of one location instead of having it out of multiple locations. So I think that they're using it very well. And then Merit Resources is also doing a similar thing. They were having a hard time with the Spanish speaking, trying to hold group meetings and such, and so they are now doing it as one location as well, and able to implement that. And they're finding that is successful for them as well.
Mm-hmm. Yeah, it's good. I think that, and editorialize each of these things, but Rhonda, I would assume y'all are using some telehealth, probably heavily using telehealth too.
Did you say Rhonda?
Yeah.
Sorry. We're trying our best. With our patients, we're probably using telephone more than telehealth. Well, I know that's not probably. We are trying to walk them through, how to use telehealth, but the majority, even though they have the capacity, we're doing more telephone. What we call them hybrid visits. So we're doing a lot of telephone, and then some of the work is actually done in their cars out in the parking lot.
Okay, good. Julie, you go ahead.
Yeah, Diane, this is Eric. I had a question. Two questions, actually. I guess number one, is there a singular platform that you're recommending or that they're using, or do you have multiple platforms being used?
I think a lot of them are using the healthcare Authority provided Zoom licenses for most of the behavioral health providers. And I think most of them are using the Zoom for healthcare.
And then my second question, and this comes up because of one of our recent experiences that our community paramedic helped with. We had an individual, this gentleman actually was an engineer on the Apollo 11 mission, and he could not figure out how to run a telehealth, which tells you something, not sure what, but our community paramedic was able to help him and his wife with an important telehealth medicine that he had. What kind of needs are you seeing out there to help? Obviously, the elderly are some of the ones that need some of this help the most, to get them the assistance they need to be able to engage in telehealth.
You know, I know, like with Rhonda, I know that they're doing the telephone with a lot of elderly patients instead of the telehealth. But honestly, I'm not sure. Maybe Martine or Sam could answer that better.
Mm-hmm.
Martine? Yeah.
Okay.
So I
sorry, I'm talking
on that, Brian.
Yeah, please go.
Yeah, I know that, this is Rhonda, I know that, you know, and I know that we're not alone, but I know that the community health centers, a lot of what we're doing with our care coordinators and our outreach workers and reception even, that's a big part of what the outreach is calling ahead and helping patients that have never done telehealth, just helping them walk through how to set it up and help them practice using it before their visit. But it's still difficult. We've also talked with our managed care organizations about helping that as well, particularly with, you know, with the Medicaid clients. And the MCOs, I think that's a good idea. So I think some of them are actually trying to do some of that outreach as well to help people. And in some cases, because most of our clients that have phones, many of them actually get the Androids from the state. And now that the state has gone to a single phone, all of those are Androids, and so they do have video capacity. So it's just a matter of persistence and being, you know, keeping trying until people are comfortable.
Yeah, that's good.
I can add a little bit on that as well, Brian.
Okay.
Yeah, I have been hearing from, you know, the different sites that it is a challenge for some of the, you know, the community members, especially the older ones that live, you know, by themselves. It's just harder for them to, you know, jump on a Zoom call and, you know, click here, dial these numbers. You know, it is confusing for them. And even, you know, my wife is a medical assistant at a clinic here down from the office here in Kennewick. And she's at a senior clinic, and she always tells me, like, man, we spend so much time trying to walk the patient, you know, give them step by step, you know, click here, click there. And even then they have a difficult time. So sometimes they spend 30, 40 minutes trying to just, you know, get them to be on the call. So it is a bit of a challenge. But some of the organizations are, you know, doing education and, you know, just kind of bringing that up. Hey, do you know we have this service? You know, we have the patient portal that you can also utilize. But it's just, you know, that education piece and just always making sure that they're reminding their patients, hey, this service is available. You know, make sure that you're utilizing it. But it is quite a bit of a challenge, you know, for those people that don't have internet and that are older and that can have difficulties with, you know, that technology.
Okay. Well, obviously a lot more to come. I think we're all struggling with the same things, but it has moved forward substantially over the last couple of months. I can tell you here we're using it in areas that we had not considered before, simply because you have to. I don't think it's going away. All right, so the next one here is the road to sustainability with Chelsea.
Hello, everybody. So this article pretty much just talks about the different activities we are doing. We're still plugging and chugging with our sustainability plan. We are super excited with all the results that are coming out of the activities we're doing to help develop this plan, which includes, you know, looking at the trends across healthcare, technology, and innovation, as well as doing some nice internal work with identifying our core competencies and our organizational values, And then we've also done some really neat things around staffing capabilities through measuring our emotional intelligence, which was a really neat activity that we got to do, as well as the directors had their 360 review. So we're really trying to bring a multifaceted, holistic approach in making sure that our sustainability plan is set up for success and for our future.
Okay. Very good. We're still looking at the August retreat, assuming that goes down yet. Okay.
Yes.
Correct.
Okay. Next item on here is the Learning Collaborative schedule. Diane?
Yeah, so next month, Sam Rebel's gonna do a shared care plan and Learning Collaborative, but also we're going to be modifying that one. We're going to be hopefully discussing that this week, but Sam and I still have some things that we need to talk about. But Sam, did you want to talk about what we're adding?
Yes, shared decision aids. We actually received, Carol can talk more about that, but we actually received a grant for that. So we're going to incorporate that into a learning collaborative with the other one. The EMR, when it was originally scheduled, we were going to have a work group of like EMRs for people to work together to see what best practices or what processes are implemented that work within their EMR system. So we're changing that.
Okay.
Yeah. So for the August one, I'm still kind of put this on hold, but I think what I'm going to do is I think we're going to turn that into a webinar instead of having it an all-person, in-person meeting. So that one I need to work with Allison. She's already agreed that she would do that as a webinar, since we're still probably most likely not going to be able to hold more than 100 people at an event. And then in September, Sam's going to present again on how to maximize the Medicaid reimbursement. And then in December, we're going to try to have a cultural competency training. Also, I just want to add that there's a few more things in the works that we're working on. One is that we're wanting to put together some kind of PDMP, prescription monitoring program, and I'm trying to work with the Washington State Department of Health on trying to get a webinar on that. It'll probably be just a short one, maybe an hour long. And another one that I'm working on is a sprint with the sprint webinar with the Benton Franklin Walla Walla Opioid Resource Network to help. And we're going to have maybe a couple different providers present in that on how to recognize patients with OUD and just ways that the ORN can help the physicians. So that's another one that we're working on.
And social determinants of health.
Yeah, and that's another one. So we have 3 that we're still kind of working on. And with this whole COVID thing, we've really kind of, there's things that that we're trying to be able to do as webinar-based learning collaboratives. So that's, we're trying to add a few more this year since we can.
Okay. Any questions for Diane and Sam? Okay, very good. We can probably move on. Thank you for those reports. They're all very, very good. Next item on here has to do with Carol and Becky with the advancement of provider incentive payments, correct?
Right.
Okay, talk about that.
Go ahead, Becky.
Oh, okay. Well, so I kind of talked about it a little bit on my report. Oh, I just lost my screen. Oh, there you are. So we, I don't know what else you want me to say about it, Carol. So we like I said, we spent 2 weeks accelerating payments out to the providers. We've been hearing from them that they're all very appreciative of the accelerated payments. what, Carol, I don't know what else you wanted to say about that.
And it was about 3.4 million?
Yeah, about 3.2, I think.
Okay, great. Thanks. That's it.
Okay, that's
Okay,
good.
good.
Well, I know that.
I'm sorry, did you say when those were going out, Carol or Becky?
They're out.
They've already.
They're out? Oh,
Yeah.
okay.
All right, very good. Thank you. Coveries Grant Award. Carolyn, Becky.
So in 2019, the Healthcare Authority had a alignment call talking about shared decision making. Emily Transu, who's the medical director for the Healthcare Authority, mentioned that they were planning a learning symposium in April for shared decision making, and if anybody was interested, let her know. So I followed up with Emily and said, yeah, we're really interested. Greater Columbia is actually incenting providers for shared decision aids. We have that as one of our milestones in our toolkit. She was really enthusiastic about it. We were trying to figure out if there was a way that we could partner with the Healthcare Authority in doing a similar shared learning over in the in our part of the woods on the east side of the state. And it didn't turn out, but during that course of time, I found out that there was this grant opportunity through Coveries, which is actually an insurance company that's not very present on the west side, on the west coast. They're primarily East Coast, mid-continent of the United States. And so I didn't think that we would even be a candidate for this grant award, but Sam and I worked on the grant award for a shared decision aid learning and awarding incentives for shared decision aid usage for our providers. And we actually submitted our application in January and found out, and then COVID hit, right? So we found out in March that they wanted to have a lot more questions answered. So we answered their questions and found out last week that we were awarded $50,000, which even though that can't be applied to the conference because the conference was subsequently canceled because of the COVID epidemic, we'll still be able to use that to carry those incentives forward for our providers beyond the 2021 timeframe. So it's really just helpful to get this funding for incentives and to pay out our providers. We haven't physically received the check yet, but we were awarded the grant of $50,000. So we're really happy that we have a little bit more money to work with for provider incentives in the upcoming years.
Very good. That's great. Congratulations. It's not every day that you get $50,000 handed to you.
Yeah, no kidding.
I like that. That's good. Okay.
Thank you.
Next one is, thank you, Behavioral Health Internship Program Tracker. I saw that in Tracker, not Tractor. I saw that in here somewhere. For me, it's tab 3, I think. Yes, that.
So this is me.
Okay.
I'll tell you what's going on. So we put together just to kind of see where people were at. We know that right now some of the organizations have had to put their hiring of their intern on hold, and some of them were just barely able to get their contract signed. With the whole COVID thing, things have just kind of been, not as fast. Since we finished this whole thing right when the COVID virus started, where some of them weren't able to hire yet. So you can see in the status column there, each one kind of notified us. And the one that you guys have doesn't have Police River Counseling is on because they got it to me this morning. And they said that they did hire the person, but then the person ended up getting sick, and then they actually moved back to Idaho. So they wanted to know if they could reallocate the money that they had for that person to hire another person. So anyways, so does anybody have any questions on any of these? I won't go through each one because I know that you guys can read them, but if you want me to, I can. It's really up to you.
No, I think it's fine. I think it's just important to be able to keep an eye on it and see where it's going. Because I think you're right. I think some of it got hung up in the COVID crises.
Yeah. And some of them too, I know that Dan could probably talk about the workforce thing with the schools. Some of the schools, you know, some of the programs are all online now. And so I'm not sure even how that's going to affect it all as well.
Right. Dan, you got any thoughts?
I mean, that's certainly one of the things we're working on. So we've been fairly successful at getting what we're calling it kind of safely back on campus and operating labs, simulation activities on campus. It's taking a lot of resources because we're having to do the extra cleaning and sanitizing. We're having to restrict the numbers of students coming on campuses. I mean, really, there's so many issues. And I guess I want to highlight what I would call the pain point of the challenge of getting students finished with their clinicals. And I don't want to belabor this, and we could probably take a full hour just talking about it. But I think the Leadership Council this morning was really timely because we're really going to have to pay attention to our current workforce. And as we end up losing or stressing out our current workforce, we're going to have to pay attention to the pipeline. And, so we really need our industry partners to kind of recognize that our pipeline that we're producing may end up being, you know, replacing the healthcare workers that are stressing out. So that's just, I know that's kind of, you know, an editorial according to Dan, but I really believe we need to be paying attention to that pain point.
I could think of some administrators who need some stress relief and replacements. I don't know. I'm just thinking out loud.
Well, I hope on that note, again, we could take a full hour just talking about the Department of Health has sent out some really good predictions or forecasting around behavioral health surge need, and it's let's just say it's going to hit the fan pretty quick here, so we really need to be addressing that. I know that we're doing it at the community college level, thinking about how we're addressing it with our students, our faculty. Yeah, so I mean, we already have a pinch point or pain points with our pipeline for workforce. And we need to be working together with our industry partners about how to address that.
Okay.
That's probably too much, right?
No, it's good. It's perspectives, and I think they're good because we're all feeling them. It's good to hear that other people are feeling them too, or at least we recognize that they're out there. Okay, thanks, Diane. Wes, you've got the performance trend report. Oh, there it is. Holy crap.
Don't panic because
I see the blue parts of my eyes as I look at this.
Yeah, so this is an attachment in your packet, and I hope not to go into detail into this report right now, and for one very obvious reason. But before I explain that reasoning, let me just explain that Healthcare Authority sends us these very large data files that allow us to assess our performance across a variety of performance measures. Almost all of them are pay-for-performance measures. So, you know, the numbers needed to treat is something that we've talked about in the past, and this is not that analysis. This simply compares us against the statewide average. So if we're better than the state, we're in green. If we're worse in the state, that we're in red. That said, this does not have anything to do with how we get paid.
Right.
This just gives us a high-level viewpoint about how the Greater Columbia compares to all the other counties, or actually all the counties in the state. Very briefly, the areas that stand out and have stood out for a while include emergency department utilization, substance use treatment penetration. Although I will say our ORN programs are working really well. And they started, for the most part, after this analysis was done. At that point, at that time, and the last data point here is through June of last year, we had some ground to make up. And then after that, it was asthma medication management. So this gives us a trend line. You can see those little trends in those little gray boxes with the squiggly lines. The light blue numbers are the statewide numbers. So all that said, I will give an editorial here and say that these numbers are now meaningless, because we all know in the last several months, a whole lot has happened to change how healthcare utilization has occurred here, there, and everywhere. So I just wanted to provide this as something that we've done, but going forward, we're looking for more timely data to see exactly where we're at right now.
Okay.
Anybody have any questions?
Oh, no, that's pretty good stuff. Okay.
Thank you.
Thank you, Wes. Next one, reporting highlights from the CSI dashboard for cohorts and the user's guide preview. That's Martin and Wes. There you go.
Wes, did you want to review the user guide first, or do you want me to give you the screen to review the dashboard?
Is Martin not on?
I am on.
Oh, Martin, why don't you go ahead?
Okay. So this, as you all know, we have the CSI dashboard that we showed you guys in the past, and we've been talking about it for quite a few months now. It's been rolled out to our providers. So for those that have access to the portal, they have access to this dashboard. And Lauren created this user's guide, which is really, really helpful to navigate the CSI portal. So it has an introduction. It walks you through, how to access the dashboard, where to go. And then it also shows you, what each graph is telling you, what the information is on that graph, and from where that information is being pulled from the milestones. So if you guys notice on the graphs here, they have letters in the circles. So there's A through O. And all those at the bottom, there's a description. For example, A is the number of sites that are present, for whatever cohorts you guys have selected on there. And these, graphs are just a quick snapshot of, you say, hey, I want to see how cohort 1 is doing. So you go to the middle console, and then you select cohort 1, the type, the site, and then transformation quarter. As you guys know, cohort 1 is in their second year. So there's data from quarter 1 of last year, P1, Q1, all the way up to P1 or P2, Q1, which is project year 2, quarter 1, which was the quarter that you guys that they submitted this previous quarter. The console only lets you select 4 quarters. So if you guys want to say, hey, I want to see, all of last year, so you would have to go into the console and select the first quarter of last year, and then select the first quarter of this year. And then then you hit update, and then that should give you the data for all of cohort 1 for these graphs. There's the top 10 clinical quality metrics, and that's a count of, how many for cohort 1, how many sites selected, what clinical quality metrics were the most selected. There's, diabetes screenings like A1C. There's other metrics that are selected on there. One thing on here for the sites, there was a confidential number attached to each site. That number is out already, and each site has that number. Because if you guys remember, when we discussed this about, do we want to have their names up there on the dashboard? And we or you guys agreed that no, the name shouldn't be up there, just because it kind of gives it more of a neutral ground for everybody to come in and see their data and not feel judged. Like, oh hey, they're not doing really good. So we attach these numbers to each one. So based on the site number that they receive, they can come in here and unselect all of the site numbers and look for their individual site numbers selected. And depending on the cohort, then you would, have to filter out the cohorts on there and the quarters. And then there's also, we broke it down by type. So there's behavioral health. If you want to see, just the behavioral health organizations, their data, you can do that on there. There's hospitals, there's primary care, and then there's, I believe, another section, and that includes skilled nursing facilities. Since there wasn't, a whole bunch of nursing facilities, we grouped those in the other, along with a dental site that we're working with Chaz, and then the urgent care that we are working with in Walla Walla. And all of those sites have this unique individual number, so they can compare, just behavioral health. If they're behavioral health, they can compare to other behavioral health organizations. Their primary care, they can compare with other primary care organizations. And this is also, it shows us the work that we're doing, based on, there's a graph on there that talks about the follow-up after ED and inpatient discharge. We can see that, how are we doing in that area? Because, Wes just mentioned that that's one of the metrics that we have to move, the ED visits. So that lets us know, hey, how are we doing as a region? How are we doing in those follow-ups with for those patients that are going to the ED? So we can see, that there's been a slow trend going up. So we can see that the work that our providers are doing is actually having an impact, even though the data at the state level might not show it because there's a lag. We have this as almost, real-time data that we're getting from our providers. So lets us know, hey, we are in the right path. Or if we notice something, why is that dip? We need to figure that out. Is it something that some numbers that were entered wrong into the dashboard? Or is it something, that our providers are experiencing out in the field, COVID-19, for example? That can be, these graphs probably in the next few months will probably look a lot different, just because of the impact that COVID is having on, basically on the whole healthcare system. But this is this guide is really, really useful if you're not familiar with the portal, how to access it, how to navigate it, what the data means. Lauren did a really, really good job at creating this document, along with the input from Wes and other staff within GCACH. Is there anything that I missed, Wes, that you want me to talk about?
No.
Okay. Do you guys have any questions?
Well, I think it's great. I like that. I like dashboards like that where you can see all that stuff at once. It's great.
Yeah, thank you.
All right, cool. I appreciate that. Thank you very much. These are great reports. You guys ready to move into action items? Okay. So the first items that we've got under the category action. The May 2020 financial report. Probably need to mute the somebody's blender.
Somebody
Sounds like
vacuuming?
margaritas.
Where they got to stop driving on the little drunk strips. I don't know much about those, but sometimes. See?
I like
All right.
Julie, yes.
I do too.
As long as you brought enough for the whole class, I'm in. So.
No.
Anyway, I will just introduce and then hand it off to Becky and Carol. The Finance Committee did have an opportunity to meet and look over the financial statements and get an update on the 2019 audit, which is underway. And with that being said, Becky, take it away.
Okay, thank you. I will try to talk over the noise. So, Chelsea, can you? Yeah.
I'm sorry, this is Chelsea. Hey, Commissioner Anderson, I think we're getting some feedback from your microphone. I don't know if there's a fan or I'm putting you on mute, but let me. There we go. Okay, go ahead, Becky.
Okay,
So that's
thank
what
you.
margaritas are.
Can you bring up the budget versus actual spreadsheet, please? Nope. Nope. There you go. Okay, so so all of the financial reports are in your packet, but as usual, we just go over the budget versus actual. This one is for the operations fund. So you can see our revenue that we're still working on, paying the final lend payment for the Yakima Nation. You know, of course, with COVID, they're shut down, so they're not really doing much work on that contract. And then we have our Rural Health Collaborative grant, which I think, Carol, it's okay for me to share that we are receiving more money for that grant than we had originally anticipated.
Yeah, please do.
Yeah, so we were receiving $3,500 a month for that grant, and they're increasing it to $5,000. And they've also offered to backdate it to the start of the grant period. So that was pretty exciting news. So we'll be receiving more money for that to help offset our expenses, which actually aren't what we thought they were going to be either, because we're not traveling as much as we thought we were going to. So things with this grant have definitely changed since we started. The next revenue is our skilled nursing facility project, which I think we've talked about. Carol, I don't think you did talk about the project or I think we talked about last month, the project that you're doing with our donations and partnering with Tri-Cities. So that's
right.
where that money is coming from. And then our revenue is our design funds, which is what we're talking about. So, and then we get down into our New America Money Market, and you can see that to date, as of for 2020, we've earned $39,000 in our money market account, which isn't what we normally would have at this time. But again, to the market, the way the market is right now, we're only earning 1% on that account, which is sad, but we're earning something. And then getting down into our expenditures, you can kind of go down the percent of budget spent line, which is what I look at mostly on this report to see, you know, we've got one more month before we're into mid-year, and you can see that we are not overspent on any of our payroll contracts or any of our operating. And the only time that you can see that it looks like we might be overspending is on our lens, which is actually a little deceiving because that's money from 2019 that we're still working on paying out. But I believe, and Rachel, correct me if I'm wrong, we just got the last payment out. So that will be off the books for next month. And then we have our designated funds, our summits, our learning collaborative, the internship program, which we've talked about. You can see that has been, we're getting all that money out. So it's finally off our books, yay. It's an exciting program, and it's exciting to see that money finally spent. And then there's our graph that shows all of what I just went over. We go to the district tab real quick. Please. So here you can see again that we are we're pushing funds out, and we're getting our contract obligations to our providers. And you can see the different project areas that we're pushing the funds out, which is something that the Healthcare Authority monitors for us to see where we're spending our money. And we're working on our latest update for the SAR for the money that we've spent for district. Rachel's doing a really good job with getting that together for us. Is there any questions? And I will go went over that fast, but we have a lot to cover today.
No, I don't think so. No, I didn't. We all were on the finance committee board, and I thought, or the finance committee agenda or committee meeting, and it was very straightforward.
Yep.
As I recall. Do you feel anything different, Julie or Rhonda?
No, having Becky do all the work is exhausting. So.
Yeah, I'm tired too.
Ryan, I'd make a motion that we approve the financials through May 31st.
This is Ronnie. I second that.
Thank you, Ronnie. So motion by Rhonda, second by Ronnie to accept the financials as prepared. All those in favor, please say aye.
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 Anybody opposed? Very good. Motion carries. Thank you very much. That's very good. Next item on our action list, approval of Commissioner Ron Anderson as the local government sector representative. We had sent out a nominating committee request, and Carol, can you speak to that a little bit?
Sure.
Okay.
So according to the, thank you, Chairman. We had, according to the bylaws, the board of directors are nominated by a nominating committee that's appointed by the president. So President Gibbons assigned Yakima's local health coalition leaders, Dan Ferguson and Rhonda Huff, to nominate this particular person. Ron Anderson is a county commissioner from Yakima, so that's why we felt that the nominating committee was especially appropriate. And it actually came about because Ron attended one of our briefings that Greater Columbia ACH staff have been giving to commissioners and legislators across our 9-county region. And I always make a plug for board members, especially for local elected officials, because they have been the hardest to obtain. You may recall that Ruben Alvarado sat in this position. He was the city councilman from the city of Pasco, which we were really grateful, but it's been a challenge to try to find people in local government that are willing to serve on our board. So when we threw out this idea to Commissioner Anderson during our briefing, he eagerly accepted it. I was very excited because Ron not only is a county commissioner and sits on the Yakima Board of Health, but he also is on the Behavioral Health Organization, ASO, the Greater Columbia Behavioral Health Organization. And it's particularly important to have, I think, a conduit to that group with Greater Columbia ACH. So we're pleased to make this nomination to the Board of Directors to appoint Ron Anderson as our local government sector representative, and I think he is on the line if he would like to say anything.
Great, thank you.
Well, thank you. Hopefully you can hear me without any static. I have a big screen and I have a Surface, and I had my Surface pushed right up against the screen, so hopefully it's better. Thank you for the nomination and thank you for the consideration. Healthcare is a very important item to me. As you know, Yakima County is one of the poorest counties in the state. There is a greater number of people here without any health insurance or coverage or even access to any kind of health care, I should say. And that's very important to me to make sure that those folks can reach those, or can be reached by these agencies and others, so that we can improve their lives and make sure that they stay as healthy as possible. You know, I enjoy working with others. I already, as was mentioned, I'm on three other boards. As by law, we all three commissioners have to be on the health board, but the rest of them are volunteer. I truly enjoy being on those, and this fits into my schedule. It fits into my everything else that I think is going to be important to, and I'm looking forward to working, sharing information and sharing ideas and thoughts, and hopefully I will be a good fit. If not, you know, don't hesitate to say so. But I only try to do things that will serve others. This is not for myself. This is to serve others.
Very good.
Carol, Brian.
Yes.
I'd like to say, since I carried forward the nomination, one of the things that I was excited about was Commissioner Anderson's background in business and how important that is to, you know, kind of align efforts and find those kind of mutual benefits of healthcare and business community. And I think he'll be a good addition to that conversation.
Excellent. Thank you very much. So we have nominations from the nominating committee, correct? Dan, are you heading up the nomination committee?
I submitted the official nomination.
Okay, thank you very much. We have a nomination for Commissioner Anderson to join the board. May I have a motion to approve that nomination?
This is Rhonda. I'll so move.
Very good.
This is Madeline. I will second.
So motion by Rhonda, second by Julie. Thank you very much, Dan, for your work on this, and everybody else.
Brian, I'm sorry, that was Madeline Carlson that seconded.
I'm sorry, Madeline. Madeline was. Thank you. All of those in favor of this motion, please. Aye.
Aye.
Aye. Very good. Any opposed? Motion carries unanimously. Thank you and congratulations, Commissioner Anderson. We're happy to have you on our board and welcome.
Well, thank you very much. I apologize for the camera not working. I'll try to get that fixed for next time around. But I'm looking forward to being a part of this group. Thank you.
Oh, it's our pleasure. Thank you. And actually, not having the camera work sometimes is really, really good.
I second that.
Yeah, there you go. All right, thank you all very much. So the next item that we've got on our agenda, second reading of the COVID-19 safety requirements for the office. That is no, I'm sorry, that's wrong. I skipped one. We have another action item, the social equity, social justice statement. That is a Carol, Ruben, Wes, and Lauren item. Carol, do you want to jump this or direct it?
I will kick it off. Yes, thank you, Mr. President. You've probably all seen public statements regarding what's been going on with regard to the killings of George Floyd, and the joint ACH group, the Cross ACH leaders, came out with a statement recently, and I felt like we really needed to have something coming from Greater Columbia ACH that I would feel confident about posting. So the request is to take a look at these statements. We did an internal review of the staff, so I asked Ruben to put a social justice statement together for Greater Columbia ACH, and we all had an opportunity to weigh into that statement. Ruben included all of the different versions that you're going to see from the Greater Columbia ACH staff. And granted, this is a somewhat controversial public statement for any of us. It causes pause to really think about what do we want to say. There's different versions in here, and I guess I did not want to put anything on our website or out that we didn't agree to. So whatever version that the board decides that they would like to use, or if they don't want to use one at all, would be very helpful to me.
Okay. How do you want to proceed with the discussion? Do you want to review the statement?
I don't know if have people had a chance, Brian, you think, to review all of these different versions that were sent out? And maybe we could have Ruben kind of highlight the differences between the different statements, if that would be okay, Ruben.
Absolutely. So yeah, the intention is to write a statement about what's going on specifically, with this social justice topic through a health equity lens, which is it's a key part of what we're doing, and also a statement that speaks to our population as well, and but also a statement that represents the board and the staff and many of the people that collaborate with GCACH, even though because of the diversity we have in the board and the staff and the partners we collaborate with, no one is going to be 100% satisfied. So the goal still is to make sure that the statement represents everyone to some extent, even though it's not going to be 100%. So what we have here in the blue at the top is the version that we came up with after several edits from the initial people that started working on the statement, which is Lauren, Wes, Carol, and myself. And this version in blue is what we brought to the rest of the staff on Monday. So that's the version we discussed, and probably we probably don't have to go through the edits that we went through to arrive to this version in blue letters, but maybe we can discuss and take a look at this version and the versions that Chelsea and Diane offered after the staff meeting, because like I mentioned earlier, the edits from Carol, Wes, Lauren, and I are reflected in the blue version right there. So that's what I would recommend for the sake of time, to just take a look at these three versions, the one in blue, Chelsea's version right next to it, and after Chelsea's version is Diane's. And I have this in chronological order based on when I received the input. So I hope that's acceptable for the sake of time. Maybe just look at these three versions, and maybe we can grab one and edit it here. And hopefully, Chelsea, since you have the original there, maybe you can help with the edits. I hope that's acceptable to everyone.
Okay.
Would it help if we read each version first? Or do you want to take a minute to read them all?
Ourselves is easier. In Diane's version, is there something supposed to be? It's just a comma and then nothing after we say with one voice. In mine, at least the one that was sent earlier.
Oh well, it's just to say. I think I was taking off the Black Lives Matter part. That was my biggest concern about the.
I can't really hear you.
I said I don't. That's not the right one, apparently. But anyways, I think I just was taking off the Black Lives Matter portion and not adding names at the beginning, so that it can kind of go through the the test of time.
Okay.
So how are we going to go about this? Do you want to take a minute, all of you, to read the three versions and then discuss it?
I think that's fine. Personally, I actually like the one that I like the one in blue, frankly. But I'm not any of those kind of people. I don't fall in any of those categories.
This is Rhonda. I'm with you, Brian. I tend to like the one in blue more than the others as well.
think it's broader. I think it's more inclusive, and I think it is to the point and perhaps a little less angry. Fair?
Yeah, that's kind of what I was thinking.
Okay, well, good.
I think that if the one that you guys are talking about is it begins our mission, and it has the systemic racism, housing inequity, economic injustice. Is that the one that you guys are talking about?
No, we're thinking of the very first one that speaks to in light of the killings.
Okay. Where and we say with one voice, Black Lives Matter. Is that the one?
At the end of it, we at GCACH stand in the fight to end this injustice because Black Lives Matter. Racism is a public health crisis, and we at GCACH stand in the fight to end this injustice because Black Lives Matter. It's the first one on the list that's presented.
Okay.
Again, I think it's, I mean, you guys know what I think.
Yeah, in light of everything that is happening, I think, and also having family that are African American, we call it Black. But I do like that one. Thank you.
Hey guys, I'm sorry. I had to step away for a second to handle a brief a little emergency. Are these individual ones, or are they all one read together?
They're individual.
Okay, that's what I thought. Okay, thanks. Sorry.
And as I perceive it, and Ruben, correct me if I'm wrong, the first one, the blue one here, is kind of a staff recommendation. Is that correct?
No, actually, we're presenting all three of them for the board to choose, or to choose one and then make edits on that particular one that you choose.
Well, again, from where I sit, and I don't want to speak for anybody, but I like the very first one, and I like it the way it's written. I think it encapsulates what we're seeking. It covers the spectrum, and I think it's to the point and equally captures all of the parties that we're trying to I don't even know the word is not recognized. I think it's right. It says better. I think to me it says mostly what we're trying to say. What's the word I'm looking for? Inclusive. So that would be my. Okay.
I agree, Brian, with you.
Okay.
And I think it's population health focused.
Yes.
So I think it speaks from where we're coming from.
Okay.
As an association.
I agree. Can we make a motion to advance the blue word?
We have a little more comment for a second. That was fast. I think the first, I'm not sure if I like naming people. I get that we should say the names, but I just feel like you leave people out. This has been going on so long, and so it's more than these people. It's bigger than that. It's every day. I don't know.
That's what I was thinking. This is Diane, and that was one of my things, that, what about all the police officers that have been killed and all? I mean, there's more than just the Black people that are being killed. Everybody, it's chaos right now. And so for me, I have a really hard time with this statement altogether.
I just want to say,
for me, keeping the Black Lives Matter is important. Just my perspective on it, it's more just that it's bigger than killings. It's kind of the everyday experience of African Americans in our communities, and so, I mean, killings are the worst of it, but I don't know. I don't know if I like that as like the opening line. Otherwise, I love the rest of it.
So I'm going to say this if I can, please. I grew up with a black stepfather who raised me as his own child. His mother came to live with us. She was my grandmother. As far as anybody else was concerned, I didn't care what they had to think about it, though she was a black woman. She had a picture album, and in that picture album, there were pictures of hanged family members, mutilated family members in Alabama. And that book scared me so bad, but it left a lasting impression on my mind about the atrocities that had been happening prior to me having a black family and ongoing throughout the lifetime of my sister and my brother, who happened to be half black. And if we don't say the names, we forget about the people that were killed before them. And why this came around was because of George Floyd. And in light of that, Black lives do matter. And it's been an atrocity through lifetimes and generations. So I think that we need to say it loud and proud and not be afraid of it.
Yeah, I'm not afraid of saying the names. It's just what my perspective of how I think that the way that the statement should be read at the beginning. And I don't like, I fear when you say some names, you leave so many others out. And so that's my hesitancy. I also grew up with black step family members. So I think we all have our individual perspective. One might not be, isn't more weightful than the others. But that's just my thought.
So, and this is Rhonda, I appreciate those thoughts. I think that, I guess I feel like it's important to put names to it because it makes it personal. And I think the first line does that by acknowledging that there are far too many others that we're not naming. But I think the inclusion of names does make it a personal statement. So those are my thoughts.
I concur. I thought exactly the same thing, and the far too many others brings the rest of it home. Interestingly, I just had this debate with my niece, and it's a challenging debate, and you never know which side of it you're on based on the
I think he froze.
Froze.
Yeah. So there's one particular line in the third one that I think is important, and I don't get the sense of it in the first one, in the first paragraph, and that is the final sentence. And I realize maybe we're not here to edit this and all of that, but I really feel it's important to state that racism in any form, and the reason why I add those words of in any form is because I think there is racist behavior that we don't even realize is racist. I'm not a black man, obviously. I don't have black family members. I grew up in a place that, there wasn't, the largest population of people other than my color were Native Alaskans, of which there was racism there. And I can tell you that growing up, I didn't realize it, that, whether it was jokes that I made or comments that were made, I didn't realize it. But anyway, long story short, I think it's really easy for, and I'll just say Caucasians, to not realize that they have racist behaviors, whether it's intentional or not. And that in and of itself lends to the public health crisis. And so I just wonder if there's any way we could fit that sentence into the first paragraph somehow. I'll leave it at that.
Can you, Eric, can you help us find the paragraph that you're talking about, or the sentence that you're talking about?
Oh, I'm sorry. And this is why I apologize that I kind of had to leave for a minute and come back. It was my understanding that the three blue paragraphs are three different statements, correct?
No.
Correct.
The blue
No.
is all one statement.
Right.
Oh, it is?
Yes.
Okay, all right. Never mind then. That's why I first asked that question. I thought they were 3 individual statements. So they are all one.
Yeah, the first one that's all in blue, that's all one statement.
Okay.
And then there's Chelsea's version below that and Diane's version below that.
Right. Okay. Okay. My apologies. Disregard.
That's okay.
Scratch everything I just said.
So I'd like to make a comment. I think that the issue of racism is built into our health system, our justice system, our economic system, all these systems. So this problem is not it's not about trying to fix something because somebody has been killed. Although I'm sorry it got to that point. It's not right, but we have a systemic racism issue still in our country, and it makes me so angry that we didn't fix this like we tried to in the 60s. I guess I'm getting my age down, but this is a problem that our country needs to own up to, just like we need to own up to our mistreatment of our native neighbors and those that live in our regions. We need to own up that part of the reason I have the privilege that I do comes on the backs of some of the people that were stepped on the way. And so I don't know how to say this any differently than what you've done, but with this go everywhere, and it's not about and it doesn't. I mean, saying Black Lives Matter is fantastic, but it's more than Black Lives Matter. And so the ending with Black Lives Matter, I would like to end with something else that recognizes the problems that we have in our region, specifically maybe around our native region. I don't know. It just seems like we lives, everybody, these groups that are underserved, that are ignored, that are discriminated against, that are persecuted, if you want to look at it that way, their lives matter. And we need to be, we said in here, we need to eliminate all inequities and injustices. And I don't know how to say it. I mean, there's nothing wrong with saying what it is, but I would like it to, I think the problem we're having is not about this little, I'm not trying to say it doesn't matter that these things are going on, but I think the problem is so much deeper. And unless an organization and maybe a country need to step up and say, we're at fault, and what are we going to do to make it better? We, you, me, everybody. I don't know.
This is Dana. I agree with what you're saying, and looking at the paragraphs, the third paragraph of the blue section, that first sentence seems like that might be a good ending paragraph for the first paragraph, or an ending sentence for the first paragraph in place of the one that is currently there. I think that brings together what we're kind of talking about, that we're trying to highlight Black Lives Matter, but it's also the inequities and injustices of many.
Mm-hmm.
And I had some discussions, just to let you guys know, I've had discussions around this topic with groups of Black folks that I'm involved with, family members as well as community members. So what it comes down to is when you say all lives matter, you take away from the movement of Black Lives Matter. It's not that they don't understand that there's other inequities and injustices that were created towards other races of minority. But because the movement came with Black Lives Matter, it's unjust to devalue that. And again, it becomes whitewashed, and that's not my words, that's their words. So I'm just bringing that to the table to let you know, if anything, that I would put in there is the systemic racism, and racism is a public health crisis. Those work together. The idea of having the GCACH stands together with Black, Latino, immigrant, refugee, LGBTQ, Yakima Nation, and other underserved populations in the pursuit of eliminating the inequities and injustices. It's awesome words. And I think that making extending the paragraph would be advisable.
Okay.
And this is Madeline, and I agree with Ronnie. The feedback that I've received from groups that we've been working with around this is that any type of trying to put everything into one basket is then diluting the Black Lives Matter movement. And so, the passionate individuals that are protesting really want to hear that Black Lives Matter. Everyone understands that, yes, all lives matter. Yes, we have to do this as a community, and inequities are in many different walks of our life, whether we're female, and the Me Too movement, so many different things. But the focus really, as you're leading with the killings of Black men, I think you need to have at the end that Black Lives Matter.
This is Kat.
We have a bigger responsibility. I think that, yes, this is a great, we need to start somewhere, and I'm very happy to start with this, but the problem is bigger than that. We're going to have to face the whole thing. We really condemned South Africa because of apartheid, and they went through some big where they are now, and I don't know if we recognize that in our own communities.
This is Kat from CHPW, and I just want to appreciate the conversation that we're having also right now. It's one that many of us are having internally with ourselves, with our families, with our communities, and with our workplaces. And in a virtual space, it can be more challenging. So I think this is a step in this space of making sure that we can continue to have this conversation, and to make sure that it is underpinning all of the work that we as health and health-related organizations and people that are serving communities are doing. So I think by stepping into this space and making this statement, I think it is sort of outlining what we need to do. I support the work that the staff has done in developing this statement, and I believe that we must state that Black Lives Matter. I believe that really needs to come forward clearly. The idea of intersectionality and privilege is an important one to elevate within this space, and sort of that idea of race being primary, consider the injustices and sort of how that overlaps with other isms, if you will. So I think that I don't know if it's the best use of the board, I think, to over edit, and I just want to applaud the staff for bringing this forward to the board, and would support the statement in blue if that moves us along a path to have a statement outward in an outward facing way, and then continue to identify the places in which our work underpins the statement. Because the statement, I think, going back to what was being said earlier, a statement is just a statement unless everything that we do that underneath it, around it, is shaped by what this statement is saying. Thanks
Right.
for giving the opportunity.
Kat, I think that's really well put. So thank you. I think that encapsulates everything.
So Brian, this is Carol. I have just maybe a suggestion to address Les's concern. Maybe that very last sentence, Les, and you can weigh in on this, was racism is a public health crisis and we at GCACH stand in the fight to end social injustice. That makes it a little bit broader than just because we do talk about in the very first paragraph and we say with one voice, Black Lives Matter. So it's just an offer to, you know, if that helps at all. If it's not, we could just leave it the same because I don't want to belabor the conversation. I so appreciate hearing from the board. So I was just
you're looking at the last sentence in Diane's version too, aren't you?
Well, I'm looking at the last sentence in the blue, and it would actually end, racism is a public health crisis, and we at GCACH stand in the fight to end all social injustice. And it's not just because Black Lives Matter, it's just that should be something that we're doing anyway. That's kind of the theme that I've been hearing, is that we should be in this fight from the very beginning, and not just because of George Floyd, but because it is a public health crisis. It's systemic racism that we need to stand up against. So,
yeah, and you know, Carol, I think that's okay, but I don't have something against Black Lives Matter, and maybe just recognizing that how this has brought this up, that makes it so we have to face it. You know, it's no longer hidden like it's been hidden, and instead of trying to dump it back under the carpet, we're going to step up and deal with it. And I think that's I guess what I'm trying to get to. I think that it's very important. And you know, you might even say end all social injustice. You know, that, or something that was brought out in the recent whatever. I don't know. But I just think that I'm not trying to, if we can start here and make some changes, we'll do wonderful things. I know that, again, we worked on this in the 60s, and I was pretty proud of our country for some of the things we did. And then, you know, we got to the 80s and 90s, and all of a sudden I'm starting to see it more and more. And it's just, you know, why are we going back there? You know, we keep, I don't know what it is. So I'd like us, when we do this, is to really do something and not fall back into the privilege.
So, and this is Rhonda, I'm just gonna say that, you know, I think I like the last sentence, leaving because Black Lives Matter there. I think it punctuates how we got here today. You know, it is a disproportionate number of African American men who are getting killed. And I think we can't avoid that. So, you know, I agree with everything Les said, but I also agree by not stating it clearly that we're diluting the message.
Okay. So, Kat, I really appreciated your comments, because I really do think that encapsulated what we were saying. Les, I agree too. Do we have a, shall I say, significant aversion to the blue presentation? Okay. Can we go ahead and advance this as a statement of the board? So let's put a motion out there.
I motion that we advance this.
Second, this is Kat.
Excellent. Thank you all very much. So the motion by Ronnie and the second by Kat to advance the version presented to the board, or I'm sorry, to the staff on June 15th. Statement of the GCACH board and staff. Those in favor, please say aye.
Aye.
Aye. Aye.
Aye. Are there any opposed? Thank you all very much. These are hard ones, man. What are you doing, Carol? Giving me the hard one.
Mr. President, this is Ruben. I'd just like to thank the board for taking on this very difficult topic. I myself have two grandnieces who are African American, British, Mexican, and I love them to death. They're growing up bilingual. They're growing up watching telenovelas, and just the thought that they could fall victims to, and I'm not talking police brutality, because one of my nephews is a cop in Yakima too, and he is their second cousin. So I'm on the side of good, of decency, of protecting everyone's lives. And so I really thank you for taking on this very difficult topic. I cannot help, like a couple of you, to have some watery eyes, a couple tears in my eyes. And so I really do thank you, and I really do appreciate you taking on this topic. And let's hope that in the very near future, things do get a lot better.
Thank you, Ruben. I can't speak for everybody, but I can tell you, I suddenly have 4 20-somethings at my house. This is not something I would ever recommend for anybody. And when this stuff comes up, boy, you end up with some pretty long-winded and serious debates, and it's hard stuff. But sometimes it makes you proud of them.
This is Kat. I think, again, really proud of the board for moving the statement forward. And I think one of the pieces that I added in my statement is just the work and the action that we will commit to in light of this statement. And I know many of our organizations may have social justice at our core, and or may not, or are really, again, sort of within a system that has really been built upon or built through systemic racism. And so I think perhaps as we move forward, considering how within the work that is happening in the organizations on the board and those that are in the practice transformation space, we as managed care organizations, the state, we have to hold ourselves and everybody accountable to ensure that we don't allow this moment to pass us by. I think somebody else had shared it has been happening for a very long time. And for some reason right now, we're in, people can sort of speculate why now. And so I think I just would want to make sure, and happy to again share sort of some of what CHPW is trying to do in this moment as well, where we've been really trying to work on equity for a very, very long time, but it's really moving into to high gear. And so I think just wanting to put that out there, and would be interested to consider how the board can work on what that might look like with the organizations, again, that are represented on the board, and then across the sectors that are part of the board as well.
Yeah, it's good. Someday I'll tell you about what it was like growing up in the Deep South in a very old hospital, watching people retire after 60 years, and what their changes that they saw between the 50s and the 90s. It's extraordinary. So this is a good thing. All right, well, thank you.
Brian, I want to hear that conversation with you.
I will tell you that conversation. It was extraordinary, and it was enlightening, and it was actually a little embarrassing that the rest of us didn't think of it many years ago. Okay.
Embarrassment makes us humble.
Yep. So let's move on to the next thing. Thank you, guys. What are we looking at now? So that's that. So we got a couple of SBARs on here that have just been added, correct? The contract with Tenfold. Carol, you want to jump on that? Because we're gonna need to move to get through the rest of this meeting.
Yes, we will move. I apologize for this late SBAR. You guys just got it last night. It's because we weren't able to meet with the consultants until yesterday, so we didn't really know how much to request. And if we could have done this for under $5,000, this would not have come in front of the board. But the SBAR really just describes the fact that Greater Columbia staff is looking for assistance to review and refine our sustainability plan. and to help refine and propose organizational structure to support our future state. We have worked with Chris Bonetta. He was the person that led our retreat last year. Chris Kelleher, we worked with last year, and then Mike Bonetta was our regional coordinator when we were going through the certification process, and he is just sharp as a tack. So we feel like it would be very beneficial to the staff and then subsequently to the board to have kind of an independent review of the work that Chelsea and Lauren have done to put together a sustainability plan. We were very fortunate that we hired Chelsea from New Edge, who has done sustainability planning as a professional, working with Fortune 500 companies. So we're actually saving a lot of money by having a lot of this work done in-house, but this would be more of an independent check to say, you know, you guys are missing the boat or you're right on track. Have you considered that? What about these elements of the industry? The funding would come out of our professional contracts budget. We currently have about $127,000 left in that budget. We're only 15% expended, so we can certainly afford it, but we need board approval before we can sign a contract with Tenfold Health and Chris Keller.
Okay. I read this thing last night when you got it to us. I support it. I know the New Edge guys well. We've worked with them before, and I certainly think we could use the help in the direction of, or at least the thought process in our meeting upcoming. So I would look for a motion to approve this.
I move that we accept the recommendation.
This is Sandra. I'll second.
So motion by Ronnie and a second by Sandra to advance the recommendation of the staff to contract with Tenfold Health to help us through the sustainability plan process at our board retreat. All those in favor?
Aye.
Aye.
Aye. Are there any opposed? Very good. That motion carries unanimously. Congratulations. That's great. And then the next one, Carol, is also you. This is the COVID-19 mask campaign. And I'm not sure I saw an SBAR on this, did we?
This is, again, board, I really apologize. This was just added to your agenda today. And the only reason I'm asking today is because we're not having a meeting in July. The Benton Franklin Health Department came to us on Sunday night. I didn't even see the email until Monday morning. I was out of town. And they're asking Greater Columbia Accountable Community of Health to lead a community masking and social distancing campaign that's especially targeted to the Hispanic community. They've also asked GCACH to make masks available to the community. And really the background behind this is that Greater Columbia has tried to get into the space working with local health jurisdictions during COVID. You know of all of the other efforts that we've been able to accomplish, but it's really been a tough nut to crack, especially with our busiest LHJs being Benton Franklin and Yakima. So even though we've made offers of support, we didn't hear from them until just this past weekend, and I was really excited to get this request for support because I think this is the space that Greater Columbia excels at, is to convening community leaders to come together to solve complex problems. So fortunately, we already had an idea that was being birthed. Lauren Noble came up with this great campaign idea about wearing masks. Not all heroes wear capes. And we met with the Ben Franklin Health Department on Tuesday afternoon to see whether or not they liked this idea. They loved it because it's a very positive message. It's, you know, you could do so much fun things with it, especially just thinking about superheroes and being able to use that in a social media campaign, getting people to provide testimony on Facebook. We think we can do it fairly cheaply, although we're going to need some money to launch it. So I presented this idea at the local leaders briefing that Benton Franklin Health Department has every Tuesday at 2 p.m. I had actually mentioned a marketing campaign 2 weeks earlier about doing some marketing for masking, and the health department said, Carol, we just don't have any resources to do marketing. So, but I had suggested during that briefing, well, maybe we could get our local hero, General Mattis, to wear a mask and have that kick off the campaign. Well, because the health department didn't jump on it, apparently others did. So others in the community are already doing masking campaign messaging. For example, CBC has their Hawks wearing a mask, and the city of Richland took off on my idea to use General Mattis to wear masks. So it really resonated with everybody, but the health department said, you know, would really appreciate it if you guys would focus on the Hispanic community. Fortunately, our previous GCACH president, Martin Valadez, is really interested in helping us out, and Ruben Peralta has many contacts within the Hispanic community in Benton and Franklin County. So we're already working on putting together a steering committee for the campaign, but I just feel bad that I wasn't able to get this to you guys earlier because it does require some funding. We did put together a really quick budget. It's about $22,000. That's pretty modest, and it covers some social media advertising. We would need to hire somebody to go out and do the Facebook photos, to get the releases from those people to be able to post to Facebook, to get testimonials. We're working with already with the Tri-Cities Visitor and Convention Bureau to do some PSAs. So this is just an idea that, I'm sorry it came so late in the game, to request $25,000 using some of that leftover funding that you saw last month from the Community Resilience Campaign. The hope is as we add partners, they'll be able to add into the pot of funding to do further communications, maybe a TV, a promotional ad. But what we've heard is because right now there's so many businesses that are closed, there's ample access onto TV and radio for advertising. In some cases, they've been giving it away because they don't have any sponsors for those advertisements yet. So I also put in, it would be great if we could include Yakima in this campaign. I've already talked to Rhonda, who is going to talk to the LHJ in Yakima to see if this would be something that they were interested in. So we had that as part of the recommendation if that could work out. But we're going to need some startup funding, and we thought if we could use some of that funding that was left over from the CRC campaign, that would be a place to get the funding.
How much do you need? 20 plus?
We're asking for 25, and I'm hoping that we don't have to use that much because I think Cadillac's really interested in helping us out, but I just didn't want to shortchange ourselves since we don't have a board meeting until August.
Okay.
Hey, Carol.
This is Rhonda. I just wanted to add that I have forwarded the idea to the health district, and I think the only reason I wanted to run it by them is in Yakima County they've been working with the businesses to started a campaign calling Mask Up to Open Up, and I wanted to make sure they didn't feel like this would interfere with that. So I'm hoping that they'll be supportive of this, but I thought it was important that they know that this was a possibility and it wouldn't interfere with the effort with the businesses.
Thank you, Rhonda.
I wouldn't imagine, based on that last conversation we had with them, that they're going to worry too much about that. But I think that's good that you did that. Go ahead.
Carol.
Yes.
So I was just received from the Benton Franklin Health District that they're going to be doing drive-through COVID testing. And that word isn't getting out very far for some reason. I have people still asking what they have to do in order, because I'm at the crisis center, what they have to do in order to get tested. And the 211 is taking reservations, and I guess it starts next week, next Wednesday.
No, it started this week, Ronnie. It started
this
yesterday.
week.
The
Okay.
National Guard is doing the testing in Kennewick and Pasco.
Well, I was just wondering if we could possibly couple that in with the Mask Up.
I'm sure you can. I'm sure you can.
We have posted those, that information. Lauren posted it on our website, Ronnie, and so we are getting it out on Facebook too. So, but this is a specific communications effort to wear masks and face coverings and social distancing, and we think that probably it would run July and August. Hopefully, you know, we're out of phase 1 by then.
God, I hope so.
So it's just, it would be a short-term sprint.
So Carol, this is Eric. First of all, absolutely no apology necessary. This is precisely the kind of thing that I was thinking about at our last board meeting when we had a very tough conversation regarding Ruben's efforts in that project. Every morning I come to work and I start my day off by looking at the cases over the last 24 hours. If you guys aren't looking at them, 48.2% as of today in Benton Franklin County cases are Hispanic. For whatever reason, which I don't get caught up in, that message is not getting through. It's not about testing. It is about preventing it so that you don't ever have to get tested because you don't ever have a symptom. So I think 25,000 is a start. We are a long way from this thing being anywhere near done. And I fully support this and doing everything we can to get this message out to all the public and included in Yakima if we can. So
I agree.
So I think that this message meets a specific demographic, a younger, perhaps male. I don't know how females are with the superhero thing, but you know, but I think
hey, we like
very
superheroes. My cake is in the closet, but I still fly.
Yeah, well, I understand, but what I'm saying is that I think you're going to hit a certain demographic very well with this. I think that the mask up to open up hits a different demographic, so I don't see them as a conflict. You know, I know Rhonda, you're going to check with the Yakima Health Department, but I think that I think it's a great thing to have these messages going out, because I think you're going to appeal to a different group, perhaps.
Right, a different segment. So I'm hearing a great deal of support for this. Can we entertain a motion to advance it and give Carol and her team the green light to make this happen?
This is Sandra. I'll motion that we approve.
This is
Good,
Madeline.
Sandra.
I will second.
Okay, motion made by Sandra, second by Madeline, right? To accept the recommendation of the staff, authorizing the communications project for the wearing masks. All those in favor, please?
Aye.
Aye. Aye. Any opposed? Okay, very good. Thank you very much. Congratulations, Carol. That's
Thank
good
you
stuff.
so much.
Under the next item we've got here is the second reading of the COVID-19 safety requirements for the office. We spent a little bit of time on that last month too. And I don't remember there being a whole lot of, what's the word I'm looking for? Dissension. You guys had tied things back to the CDC and all the appropriate entities, correct? To meet the guidelines, and as you bring your staff back, we want to be careful and protect our staff. And you know, I can tell you, I've got a hospital full of patients or full of employees, and I got a hospital full of patients, and people are afraid to come to the hospital because they're going to get sick. The way I look at it, you know which ones are sick. Hospitals are probably the safest place right now. So I think we advance that to the workplace, and we'll be able to get things rolling back into the place again. So do we have Carol, do you want to speak to this at all, or is there a secondary look at it?
Becky did the work. If she wants to just run through really quickly any of the comments that the board made, just for your edification.
Thank you.
Sure. Yep, I can run through it really quickly. So what I did is I went to the board meeting notes and I took all of the questions that Chelsea had taken down from the board, and then I went through the plan again, and I annotated the ones that I changed. So the first one, Sandra had suggested that we change the name, so I changed it to just safety plan, took COVID out. The next one was a suggestion from Les that we limit the time in common areas, and that was actually something that I already had in there, and so I just highlighted where I answered that question for him. And then the next one is Les again made a statement, just because you go back to work doesn't mean it's the smart thing. You can go back to work doesn't mean it's the smart thing to do. And what I had already written in here was that we were going to come up with some kind of a staggered schedule for the staff so that we're not all in the office at the same time, especially the people that are in the cube areas. Which also, just as a side note, I brought Bella's in to put up some more walls in our cube area to give people more privacy, and we turned some of our cubicles around so that they're not sharing entrances into their cubicles anymore. And then this week I have a contractor coming in to put up some plexiglass in front of Chelsea's workstation, because she's the first point of contact when you walk in the door. So we are taking some other precautions besides what I've gotten written in here. And then the next one was from Luann, suggests that we have employees take their temperature before coming to work. And I did already have that in here, saying that the employees to take their temperatures at work, and then to let their supervisor know if they have a temperature, and then of course stay home if they do. So that was it. That was all the questions. You're right, Brian, there wasn't a whole lot, but there was those. We wanted to make sure that you knew that we did address the board's comments.
Okay. Are there any additional comments, conversations, issues associated with the safety plan as it's prepared today?
This is Sandra. So I appreciate taking COVID-19 out of the title, but my comment was really throughout the whole document. COVID-19 may not be the only COVID pandemic type disease that we have. There could be a COVID-20. So it's nitpicky. It doesn't have to change, but I was just wondering if there was a different terminology we could use in actual COVID-19, because this may, in future years and going forward, apply to other infectious, spreadable viruses.
Well, that's a good point, Sandra. Thank you. I didn't understand that that's what you meant. I think, I don't know, I wrote this based off of the CDC, recommendations for this pandemic. So you're right. Hopefully we will never have something like this happen to us again, but we should be prepared if we do.
I just thought it'd be easier than having to update the policy if it was a little more generic to, than specifically COVID-19.
Yeah, I agree with you. That's an easy thing to do. I can just do a word search and replace that.
Okay, I'm good with that too.
Cool.
All right, are we ready to go? We need to we have a motion. Do we need a motion? We need a motion.
This is Sandra. This is Sandra. I'll motion with the leeway that Becky can also make those edits.
Very good. Thank you, Sandra.
I'll second.
Second is Ronnie. Okay.
Yes, it's Ronnie.
Thank you very much. So you have a motion by Sandra, second by Ronnie, to approve the safety plan as it's written, with the exception of modification of the code where it says COVID-19. Becky will manage that. I like this document. So any additional comments or questions? Hearing none, let's all in favor?
Aye. Aye.
Very good. Any opposed? Thank you very much. That motion carries unanimously too. Congratulations. That's nice work, and Becky and Carol. Thank you.
Thank you.
So next items we've got on here are the cross ACH work products, and we've got about a half an hour to get through it. Again, this looks like it's got a lot of meat to it, so this ought to be pretty interesting.
Yeah, Mr. Chair, and we can defer these when we have a little bit more time, but there were a couple that I just wanted to draw your attention to, especially the social investment model. because this is a conversation that we are just having right now with the Healthcare Authority, even though probably most everyone acknowledges that social determinant of health needs need to be paid for somehow, either through with some sort of mechanism. And so the cross ACH leaders have been talking about care coordination and the need to be able to pay for social determinants. And so this body of work really was ongoing from discussions we've had since 2019. So it culminated in this statement that went out. I guess one of the ACH board members, or one of the ACHs, handed it out to their board early last week. And so we wanted to make sure that all board members across all ACHs had a copy of this concept that was developed by the cross ACH leaders. And basically, social impact or social investment funding is not a new idea. North Carolina is currently experimenting with that. And so this is really a concept paper that the ACHs wanted to have in front of the Healthcare Authority for them to look at. We actually met with the policy people from the Healthcare Authority on Monday morning and had a great discussion about how to move this body of work forward. But it's just, we're in just the initial discussions of it. And so I wanted you guys to have this information. So if you heard about it from other board members or other people from across the state, you would say, oh yeah, we saw this concept that's being developed by the cross ACH leadership in conjunction and collaboration with the Healthcare Authority. And obviously we'll want to bring in our MCO partners as well, because we already know that they're operating in this space. And so it's a broader discussion of not just, talking about the medical loss ratio. It's really talking about a need to look across the state in looking at investment and investments as they relate to the social determinants of health. I think this gets right back to our conversation that we had about systemic racism, and the fact that there are many people that are living with a lot more social determinants of health that really impact their health. So this is just one of those concept papers that I wanted you guys to have.
Okay. Very good. Thank you.
Brian,
Thank you, Carol.
Go ahead.
So Carol, it's Rhonda. So one of the things that I think is an easy win in the conversations is, we have been reporting, many of us have been reporting in our diagnoses and our problems that get reported to Medicaid and Medicare on social determinants. There are, a couple dozen Z codes that relate to social determinants around education and poverty and housing status, and education levels. And those get reported, but they are not considered, they don't have any quantitative or qualitative value in the complex care codes that rate how patients are valued or paid for. So they don't add value in the complexity of the patient care. And that's information that Medicaid and Medicare already have. If they would assign point values to those social determinants, that would be one way that we could get increased payment for those complex patients that we're caring for.
Okay. That's exactly what we hear Sam Wardell saying every time we have a legislative briefing, is really it goes to a lot of the coding and what is already being done at the Medicare level that we're not doing for Medicaid. So thank you for that information, that input, Rhonda.
Okay, very good. Do you need, so these are discussion items, they're not action items.
Right.
So you've got a cross ACH work product related to statement against racism. I'm assuming it's similar to what we just did.
Exactly. And some of the wording that we took from our statement came from the cross ACH. I just wanted to share this with you. Okay. The next thing is the joint policy statement on care coordination. Again, this is another work product. You guys saw a version of this. We weighed into the fact that Greater Columbia ACH really is tied to the PCMH model. We're tied to the fact that primary care is a driver for a robust healthcare system. We incorporated those comments in here. So this is, again, just a policy statement around the vision that the ACHs have for community-based care coordination. If you'll scroll down just a little bit, Chelsea, about the essential components, you'll read that the essential components here, you know, it addresses social determinants. It provides a continuum. No, go back up. Provides a continuum of care. Leverages trusted community-based workers. Utilizes standardized processes. There's nothing in here that I felt was counter to what the way that Greater Columbia is viewing care coordination.
Mm-hmm. Okay, excellent. That's good.
The next statement was around a community information exchange. Again, this is another group of work. This is resulting from the group think around community health information exchanges. We distilled, again, the essential components of a CIE system. I think that the ACH leaders are really trying to honor Sue Birch's idea of standardization and trying to create a system of care by standardizing some of these essential components that we're seeing in community-based care coordination and community information exchange. So we had worked together with a consultant early in our last year, 2019, who helped us put together this. You guys saw the CIE document that Wes presented, I think it was last month or the month before, with Greater Columbia's crosswalk. So again, this is just another policy document that shows what we think are essential components of a CIE system. Bidirectional closed loop referrals, a resource, a database, and shared language.
Are you getting, is it consistent with what everybody else is seeing? And are you getting pushback against that?
No, we're actually bringing all of these ideas together. I think we're kind of leading the charge. I don't know that the MCOs have necessarily weighed in on this as much as the Healthcare Authority has, but I don't think that we've gotten that far in terms of getting pushback, Brian.
Okay, that's good. That was my only question. Okay.
And then the last is really just a slide on how the ACHs have been working on sustainability. This is a big body of work that Greater Columbia has is addressing. The board will see the fruits of our labor in August, but this is all the ACHs came together, and our consulting team Artemis put together all of these elements that we have in common. So we're fairly split in terms of where we're at with sustainability planning. Most of us expect to have a sustainability strategy approved by the boards by the end of the year. And then you can see the commonly cited key values of the ACHs as a convener, a connector, strong partnerships, community advocates, leveraging resources, addressing SDOH, advocates for equity, and advocates for whole person care. So this is just a summary of what we're all working on in terms of sustainability for our organizations.
Okay, very good. That's good.
That's it.
Okay, all really good. Next item here has to do about the virtual board meetings. I like them. I mean, it's nice to see everybody's face, but it's also nice not to have, 3 hours of car time on a Thursday. It kind of blows your whole day. And we get a lot done. So, Chelsea, is that what your thought is on this discussion?
Yes. So, just as a result of the pandemic, we've obviously switched over to teleconferencing in our virtual board meetings. And it's pretty clear that it's, as Brian said, it's nicer. It saves some time, money, travel in general, and it helps reduce costs for the organization. So I think I think this is going to be the way we move forward with our board meetings, is to be more virtual, other than the actual board retreat, which would meet in person. But moving forward, we'd be shifting our board meetings to be virtual, if everyone's okay with that.
Would you move learning collaboratives to, or leadership council to virtual? Because usually it's like my GCACH day. So just a thought.
That I don't believe we have discussed quite yet. We just have discussed that with the board, but that's something we'll definitely need to consider moving forward, especially with our other events as time goes on, even beyond the pandemic when we move out of the phases. So that's a good question we'll have to take back. Carol, did you have anything you wanted to add?
No, I think, Brian, we had talked about virtual board meetings and maybe doing, like once a quarter we could meet in person because it's really nice to get together. But as a time saver, I'm telling you, it's saving, I think, especially the people that come all the way from Yakima or from Columbia County, I think it saves a lot of time, road time, to have virtual meetings.
Yeah, and you can do hybrid ones too. I mean, we can do somewhere, some folks. I mean, I used to call into them too. They're hard to call into. They're easier to do it this way, actually.
So this is Rhonda, and I agree. I love those. But for those of us that attend both, it's going to be hard to have one in person. You can't go. I can't get from the leadership council to back to my desk for a hybrid, or I mean, for a virtual board meeting. So that's just something to consider.
Yeah, no, I think that's what I'm getting at. Now they're doing the morning meetings down in Tri-Cities. I think when it clears up and we're able to get face to face, we're going to need to be doing that some too. So probably the hybrid version is going to be the way to go.
Yeah, but I would even suggest that these are actually a little easier to manage the technology, because more often than not, it was really difficult to hear when it was a hybrid meeting. Having called in many, many times and feeling quite frustrated with the lack of clarity, particularly for those in the room in person.
Well, we might have been doing that to you on purpose.
I could definitely understand that coming from another redhead.
I was there at that decision-making meeting.
Yeah. No, but I agree. I think this is probably the wave that we're going to be in for a long time. Plus, I think it's going to take us a long time to get out of phase one, at least in Yakima County. I can't really speak for Benton Franklin, but I don't think any of us are close. All right, you want to talk about the board retreat?
I would love to.
Assuming we're going to be able to travel by then?
Knock on wood, we will be able to travel by then, and it will be taking place at the Marcus Whitman Hotel in Walla Walla. And so, like it says on there, it will be August 20th, and so that's the third Thursday, which is usually when our board meetings take place. And we will be providing a virtual option for those who cannot travel. And so we're super excited. Obviously, we'll be discussing our sustainability plan. And so you'll see all this great work unfold.
Very good. We'll have to take bets on whether I got my kid out of here or if he's still with me instead of being in Orlando. It's time.
Ryan, I told you before, you got to cut the apron strings.
I told you, I moved to Washington. I don't know how else you cut the strings, and then they all showed up.
I'm pretty sure you're going to move again before you get rid of her, Brian.
So, Carol, is Leadership Council canceled for both July and August?
It's canceled. It is canceled for July because we have the Learning Collaborative. The August Leadership Council is actually Allison Masari. So that was part of the, or is that just the Learning Collaborative, Diane?
That's just the Learning Collaborative.
Okay, all right. So we haven't settled on August yet in terms of the Leadership Council, in terms of where it's at.
But will it be a different date? If the board retreat is that day, will the Leadership Council be a different day?
That's a really good point. I hadn't even thought of that. We might even cancel it, Rhonda. I'll talk to staff about it.
All right.
Thanks for the reminder.
Okay, you guys, I think we might have set a record on the number of items in the board agenda this month. I saw 17. And then we added that's 19.
Virtual is working.
Yeah, I really do appreciate it. This was, I thought, an excellent meeting. We got hard work done. We got good work done, and yeah, it makes you feel good. So I'm grateful. Thank you guys for your participation. I hope you have a good week and a good rest of the month, and you stay safe.
You too. Thanks, everybody.
Thank you.
Thank you.
Bye.
Bye.
Happy solstice, everybody.
Appreciate it.
Happy solstice.
Yeah, right.
Happy Father's Day.
Happy Juneteenth.